I want to be clear here when it comes to the Republican plan and the health savings account, because the way in which they spelled this thing out was it would allow adults earning under 700% of the federal poverty level to access $1,000 per year in a tax-advantaged health savings account if they're younger than 50, and then that would rise to $1,500 a year for those that are 50 to 64 years of age. That's not a lot of money. That would not necessarily cover the cost of much of anything when it comes to visiting the doctor, especially if you have some sort of chronic illness.
Well, especially, too, when you take into account that what they were asking people to also do is move into plans with higher deductibles. So in some cases, you were talking about a plan that could have as much as a $6,000 deductible.
Wow.
So we're going to, provide you $1,000 buffer here, but you're still going to have to come up with at least $5,000 of your own out of your own pocket before you then even begin to reap the benefits of this healthcare plan. Now, if you're someone who is healthy and you are not going to visit the doctor in a calendar year and you don't break your leg or you don't get in a car accident, maybe you end up ahead because you're paying a little bit less overall, and then you can take that $1,000 and keep it in that savings account, and it builds interest and everything going forward.
That's best case scenario.
Right. If you're sick on any level, if you have a prescription that you need, if you come down with some sort of illness over the course of a year, if you have kids. I mean, my wife and I, every year when we're going through open enrollment, we're forecasting, like, how many times do you think the kids are going to go to the doctor this year? There's no way to forecast
Exactly,
that.
yeah.
You just have to, you have to be prepared for it. And so the way that Chuck Schumer described it was they were junk policies. They were policies that, provided at least the appearance of care, but when actually put into practical implementation, they probably wouldn't do the job. And so that's why you just couldn't find a lot of Democratic support. But, I think it's important to say, Yasmin, that the subsidy situation isn't necessarily a good one either. The Democrats wrote this bill during COVID with the expectation that they would go away at the end of 2025. And here we are, and there's still a need for them. And so,
Right.
Republicans have a point here in that you wrote a bill that was specifically designed to end things, and you have not come up with a plan to prevent those subsidies from being needed. In other words, the system itself requires the federal government to sort of prop it up.
Right.
And so it was going to cost $83 billion to extend these subsidies for the next 3 years. Republicans just didn't think that was worth the investment. And so that's why I think we saw the vote go the way it did.